Hello and welcome to News Desk on this Friday, the 14th of August. My name is Michelle Ngele Odhiambo. We begin this bulletin with some uncomfortable news on the fight against COVID-19. Public hospitals have started charging COVID-19 patients for protective gear used by health workers treating them after the government reneged on its promise to foot the bills. Patients are being asked to foot their bills with a big chunk of the charges catering for masks, hazmat suits, gloves and other PPEs that health workers don while on duty. There are allegations the government has not been releasing cash to the facilities for the bills accrued by COVID-19 patients. But what does this mean for the fight against the pandemic? We'll be speaking later on to Dr. Masi Korira. I understand we already have her on the line. Dr. Masi, many thanks for your time on News Desk this afternoon. Increasing these costs, looking at a report here by the Kenya Medical Research Centre, the average you're looking at is 21,000 shillings per day for asymptomatic patients and slightly more for symptomatic patients. What does this mean for the fight against COVID-19?
I think, Michelle, we should be alive to the fact that healthcare costs something. And anytime you're admitted in hospital, be it for COVID or anything else, there are some costs that have to be incurred by the facility that is admitting you, be it the public facility or the private facility. So there are costs that have to be incurred. So in this case now, we are looking at a unique situation where the country, and not just Kenya, the globe actually, is fighting COVID-19 pandemic. So here is a situation where costs have to be incurred when somebody is admitted in hospital. So the question here is who should be paying for these costs? Now, we know that healthcare in public facilities is subsidized, and so it is a little bit better if somebody is going to foot those costs. But now looking at the pandemic, and earlier on during when we announced the first case in the country where insurance companies says, it is a pandemic, we do not cover pandemics. So the question was, who is going to pay for these bills? Remember, we are also at the backdrop where Kenyans have lost jobs, Kenyans have had pay cuts. So the big question is who should foot for these bills? And ideally, we all look up to the government to foot these bills. One, because as Kenyans, everyone pays taxes. There's a budget to the healthcare services. Two, there have been funds that have been released or that have been allocated to the COVID pandemic fight. And there's been loans from the World Bank, for example, for the COVID pandemic fight. So here the question should be, how can the government come in and bridge that gap and be able to meet Kenyans halfway in terms of putting those bills, at the very least, in public healthcare facilities. Now, you rightly mentioned, because KEMRI, Kenya Medical Research Institute, with the Wellcome Trust, did research to see the average cost of healthcare for somebody who's been admitted. So obviously, somebody who doesn't have any symptoms should stay home because the cost of that is almost nil because you are in your own, in a familiar environment. So those with mild symptoms, now that is where when you go to a facility, then you probably need to be on oxygen, you need to be monitored. All of this come at a certain cost. And this is now where the estimates now started coming from 21,000 all the way to 71,000 per day in critical care. Now, critical care obviously is more expensive because there's more that is needed. The cadre or the caliber of the personnel that even attend to people in critical care is higher. Because you're looking at your well-trained critical care doctors, critical care nurses, you're probably on ventilatory support. There are more tests that are being done, be it laboratory or radiological tests. So the costs are more. So we expect those costs to be there. So the conversation should be who is for the public facilities so that Kenyans can continue accessing services, seeing that COVID actually can cause deaths.
That research by KEMRI Wellcome Trust, as you say, accounts the PPEs, it says, account for about 65% of the total cost of your COVID treatment. But also these costs are also being pushed to non-COVID-19 patients. Many of those who are admitted because hospitals have made it mandatory for health workers to wear protective gear when attending to all admitted patients. So the non-COVID patients are also bearing the brunt of the same treatment.
Michelle, if you go to a hospital right now, the healthcare workers do not know if you have COVID or not. So do we want to be in a situation where we have exposed our healthcare workers? We are reporting deaths. We are reporting now there are almost at 1,000 who have contracted the virus. Do we want more of these healthcare workers to go home on isolation or quarantine because we did not protect them? So anyone going to hospital, you would even be more comfortable as a patient when you go to hospital if your healthcare worker is well protected, because one, you're not just safeguarding the welfare of the healthcare worker, but they are also safeguarding you, because they're at high risk of contracting the virus. So if they are not properly protected with PPEs, then they are likely to transmit the virus, if at all they have contracted it and they're asymptomatic, to you, who's going there for other non-COVID related services. So here the question should not be that this is only a cost for COVID patients, or this is non-COVID patients should not be footing this cost. This cost should be spread across, because it is our own, all our safety, whether you're seeking COVID services or non-COVID services. So it is the right of healthcare workers to be well protected for themselves and also for the people who are going to attend to them. So the question here should be, who is attending to that cost? Remember, Michelle, what I said earlier is that there's been monies, loans, and budgetary allocations and reallocations to the COVID fund. So the question should be, have we used that money properly in terms of kitting healthcare workers, so that you remove that cost from patients who are going to hospital? So
especially considering, because it was a promise made by the government. But even as we ask that question, Dr. Masi, very, very briefly, many are asking whether some hospitals are perhaps taking advantage of the situation, because there are some who are charging as many as 10 units of full PPE a day at about 4,000 shillings. Are some hospitals taking advantage?
I wouldn't know if some hospitals are taking advantage. It would be good to have a look at those bills and look at every itemized bill and cost in the whole bill, because one, I would imagine if you go to a health facility, it's not only one person who is attending to you. You probably have a doctor, a nurse, there's also a cleaner, there's an array of people who have to be adorned in those PPEs. So at this point, I cannot say that some hospitals are taking advantage or not until we see the full bills and look at each itemized, each item, and see what it is and if there's any explanation to that bill, Michelle.
All right, many thanks. That is Dr. Masi Korir shedding some light there for us as public hospitals now begin charging COVID-19 patients for protective gear used by health workers treating them following after the